This is St. Vincent's Health Talk, a video magazine with the latest news and developments from St. Vincent's Health Services. In this edition, as always, we start with safety first by highlighting employees who have volunteered to serve as safety coaches. We will introduce our new midwifery program, take a close look at our Vestibular Therapy Program, and discuss the launch of our Always campaign. At St. Vincent's, we're investing in the future and working hard to be the hospital of choice for patients, employees, and physicians. We begin this edition of Health Talk discussing safety, just as we do each morning in Safety Huddle and at the beginning of each meeting at the Medical Center. The Medical Center has impressively increased awareness about safety and has been awarded the Connecticut Hospital Association 2012 John D. Thompson Award. One of the elements of being a high reliable organization is to reward and recognize our safety coaches. So, in this episode of Health Talk, we recognize Lisa LaFlamme, a CAT scan technologist in the Department of Radiology. Lisa explains what it means to be a safety coach.
I wanted to become a safety coach because I felt it was important to me as far as the hospital goes and our patients that come here. I feel like every patient is like a family member, and I just wanted to pass that on to them and have them feel safe and secure when they come here, not just for them but also for all the employees. My goals were to help improve our department even a little bit better than what they already are. And to make sure that the patients feel secure and safe and confident with their care. There's been a few adjustments that we've made as far as patients coming down to the department after a certain hour, and there may not be enough staff in the department at that particular time, so we found a safer way for them to be monitored by somebody so that they wouldn't feel like they were alone in a department. We have a safety call bells for them that are given to them. And overall, the whole department's been fantastic. I mean, everybody does their job to keep up safety, so I'm kind of proud of them.
The first baby was delivered by a midwife at St. Vincent's Medical Center's new birthplace, which includes 2 private birth suites where mothers can labor and deliver under the guidance of a midwife. The baby, Jeremiah, was born on April 8th at 5:59 a.m. to Sandy Kao and Camille Allison of Bridgeport. The baby weighed in at 6 pounds 13 ounces and is their first child. Sandy Kao, a registered nurse at Yale, New Haven, explains why she chose St. Vincent's.
The advantages of having a midwife birth were that she really just took into consideration holistically everything that I planned and my family planned in terms of the birthing process, and she really just made me feel really autonomous in the decision making, and she just became a part of our family because, you know, we were always on the same page 100%, and I just felt like I totally trusted her, you know, and she knew what she was doing. She has so much experience, and they're just awesome.
Although midwives deliver babies at several hospitals in the area, the birthplace at St. Vincent's is the only in-hospital birthing center in Fairfield County. St. Vincent's has partnered with Circle for Life Midwifery in Shelton, whose staff of 2 certified nurse midwives, Sarah Najami and Paula Kate, have obstetrical privileges at the medical center. Sarah explains her role as a midwife.
Here we do no intervention. We listen to the fetal heart with Doppler. Women are not strapped to a monitor. There's no routine IVs. They get to eat, they get to drink, they get to relax, take a shower, and take a tub bath if they need to in labor. They can birth in the water. So this really provides an alternative to typical maternity care in Fairfield County. The advantages, of course, to the family is the instant bonding. You know, as I'm sure Sandy has said, the moment when that baby comes out to the parents, as the midwife is just guiding it, it's irreplaceable. It's an incredible bonding experience, and it really helps the mother get off to a good start with the baby, particularly with breastfeeding, which the hospital totally supports. So this is a really good way. The baby comes out, comes right up to the mom, and stays with the mom.
Our goal is to be the provider of choice in Fairfield County and showing our patients that we always care will help St. Vincent's enhance patients' overall experience and happiness. It will also help improve our HCAP scores. HCAPS is a patient survey administered by the Centers for Medicare and Medicaid and is designed to measure patients' opinions about their hospital experience. Discussing the importance of HCAPS and our Always campaign is the Director of Patient Relations, Daryl Bates.
The Always campaign was originated because we get wonderful feedback from our patients, but oftentimes the staff don't know what that feedback is. They don't know what's important to our patients in delivering care. So the Always campaign was developed to educate our staff on what it is the patients feel is important in their stay, and it's a way to empower them to deliver that care consistently. Well, the HCAPS questions are very, very specific, and the patients have to respond always for us to get quote-unquote credit for the score. It does have to do with reimbursement to the hospital, but it's also patient satisfaction. It tells us that patients always want us to do certain things.
To increase awareness and promote the use of Always behaviors among staff, the marketing department developed an Always campaign. Upon discharge, patients receive a recyclable bag with needed supplies, discharge instructions, and a thank you card from the staff. Tent cards are also being delivered along with one of the daily meals to serve as a reminder to patients to ask questions if they have them. Staff should be familiar with the HCAPS questions and thank patients for choosing St. Vincent's.
We have a wonderful thank you card. It's thanking the patient for choosing St. Vincent's, but we actually have staff who care for the patient that sign that card prior to discharge. We've already heard from a few patients who really appreciated that card. They got home, they looked in their bag, they saw not only the pill box and the magnet, but they saw this thank you card from the staff, and it was personalized. And that's how you build relationships, and that's how you build connections, and that's partnering best with your patients.
Our outpatient rehabilitation department is armed with skilled therapists and some of the latest technology to help patients with vestibular or balance problems or issues. Chronic balance issues tend to come from issues stemming from the inner ear or an event in the brain, such as a stroke. St. Vincent's outpatient rehab currently has 2 physical therapists on staff that specialize in treating dizziness and balance. Physical therapist Ann Wolf, a certified vestibular therapist who is also certified in treating dizziness stemming from the neck, discusses how St. Vincent's program differs from others.
Our program has therapists who are certified in treating not only dizziness from the inner ear but from the neck. We have great equipment such as the dynamic posturography machine, the infrared goggles that can help us diagnose them better, and we do a comprehensive evaluation not only of the inner ear system but the musculoskeletal system, the sensory system, all looking at how the systems are working together, which would affect your balance and dizziness. So I think that our program is far more comprehensive than others that are out there.
Patients who wish to have an initial assessment must have a physician prescription for therapy. According to Dr. Richard Levin, the vestibular therapy has shown excellent outcomes in his patients who are referred to Ann or Irene for vestibular therapy.
I think the major benefit for patients is compensation. And when people have vestibular problems who come to St. Vincent's, in all likelihood they have difficulty with the vestibular system. And so what the purpose is to help people who come to the program get back into a lifestyle where they are not falling, where they're not swaying, and where they are able to lead the type of life that they had before the problem.
The Vestibular Balance Program also holds NASA technology in their pocket. The dynamic posturography machine creates a computerized assessment of patients' balance challenges. This gives therapists an added ability to test patients in a variety of situations and assess multiple systems, including visual, vestibular, muscular, and sensory. Additionally, new infrared goggles can clearly show involuntary eye movement resulting in severe dizziness. With this knowledge, the physical therapists can tell the type of inner ear problem and why the patient's dizziness and balance issues are occurring. Irene Lindquist, Coordinator of Outpatient Physical Therapy.
And especially with the vestibular program, these patients have been dizzy sometimes for many, many years. And most of the time when we finish treating them, they're not dizzy anymore. And it's very gratifying to see that because they have their life back.
Thank you for watching this issue of Health Talk. If you would like to learn more about any of the topics discussed, please visit www.stvincents.org.